I'm going to invite Mark Grimaldi, who is graciously stepped into a coordination role with this from DMHDDSUS in support of this PCP initiative. And he's just going to say hello and introduce themselves before I cover some housekeeping. So over to you, Mark.
Hello, everyone, and welcome to our webinar on partnering with Guardians 2.0. My name is Mark Grimaldi, and I am a Human Service Program Manager at the Division of Mental Health, Developmental Disabilities, and Substance Use Services. Thank you for joining us today to explore the ways we can partner with Guardians with developing the PCP. At this time, I'd like to pass it back over to Dr. Janice Tondora with the Yale Program for Recovery and Community Health.
Great. Thank you so much, Mark. And again, thank you everyone for being here. I will just briefly introduce myself. My name is Janice Tondora. I use she, her, hers pronouns. For accessibility purposes, I am a white woman with light brown hair pulled back in a bun, wearing a black sweater, sitting in front of a beautiful spring-themed background from a duck pond in my hometown of Milford, Connecticut. I have been involved as a trainer and a tools developer in the North Carolina Person-Centered Planning Initiative for about 3 years or so now, but I am actually not the main speaker for today's event. So I am just going to say a few words about housekeeping before I turn it over to our facilitators. So just a reminder, so far this is going well. Please remember to keep your audio lines muted to really decrease any interference. Certainly feel free to use the raise hand feature. We'd also like you to actively use your chat box if there's comments or questions that you want to direct to us. Please go ahead and use the chat. We're going to save a little bit of time at the end for questions, but I may also interject and ask Leigh Ann or Nancy to say a little bit more if that seems like it makes the most sense. And then also, if anyone is having any audio, any video, technical questions, please direct those in chat to our colleague Ingrid Paget, who is supporting us. And then last but not least, very important, Ingrid is going to put into the chat a document that is everything you need to know about how to qualify for your NBCC certificate. And the basics of that are that we need you to participate for the full event. So there's a Zoom participation log, and then after the event, we connect that log to your participation. So be sure that you're registered and logged in with the unique link that was sent to you when you registered so that we can make that connection. The other requirement for NBCC credit is that there is a post-event training survey that's required for your NBCC credit, but also we do actually take that feedback really seriously and continuously try to improve what we do. So we'll be giving you a link to that post-training evaluation at the end of today's event. You'll also get it as a follow-up email. That email, ultimately, for your NVCC credit is going to come from a sender called Certifier, okay? So just keep that in mind. Please give us up to a month to get that out to you because you get a couple weeks to do the survey and then we have to crunch all the data and then make the certificates. And check your spam before you reach out. But certainly if you don't have it within a month, please do go ahead and reach out to Ingrid Paget. You can see Ingrid's email on the screen. We'll make sure that we get that out to you, okay? So having covered that housekeeping territory, again, I just want to offer a warm welcome to today's facilitators. First, Leigh Ann Kingsbury. I'm going to let Leigh Ann tell you more about her background, but I'll just say that I had the pleasure to meet Leigh Ann last year through my North Carolina work, and she's been a local expert on person-centered planning and a real champion for this model, both in-state and around the country for decades. She's got lots of expertise around areas to support PCP, but brings particular expertise around the challenges and opportunities associated with collaborating with guardians, and to do that successfully to support people's transitions at, complex transitions, especially transitions to the community life that they desire, okay? Leigh Ann did an introductory webinar on this topic that some of you may remember from back in November. It was a great start, but people were really eager for some additional tools and resources. And since we aim to please, we invited Leigh Ann to come on back for this Guardianship 2.0 webinar. And today we are also very lucky that we have Nancy Johns with us, who brings their own wealth of both lived and professional experience to this topic. And is going to speak, I think, very powerfully later on with Leigh Ann from a lived experience perspective also around why this work is so important. So warm welcome to both of you. Thank you again for being here today. And with that, I'm going to turn it over to Leigh Ann.
Thanks, Janice. And thanks for joining, everybody. We're really glad you're here. You know, I will, in full transparency, I will say it's a little nerve-wracking to be thought of as an expert in relationships with guardians, because, you know, that's sort of like saying, you know, you're an expert in relationships with all human beings. And I'm sure on more than one occasion, I haven't gotten it right. So, but I'm happy to share our experience and sort of what we've learned and some tools that I think can be helpful. We're going to start with just a quick question for you. You can do this on your laptop or your computer, whatever computer you're using. You can go on your phone. But if you would go to menti.com, and Menti will ask you to type in a code. I'm going to stop my sharing for just a moment. I'm going to bring up Menti so that you can see it. And we should then be able to see your answers as you start entering, hopefully. That's our plan. Oops, come on, come back here. Okay. The question we'd like you to answer is, what strategies have you tried when someone's guardian opposes something that the person wants to do? So if you can get to Menti.
Leigh Ann, since you're not sharing your screen anymore, can you give us the code again so that we know the code?
Sorry about that. Give me 1 second. Let me.
That's okay.
I thought that I had. Oh boy, here we go. Of course, right away. I'm going to start with our challenges. Come back up here. Come back up here, Menti.
You can access the code from the chat.
Let's see. Sorry about this. We had it all.
Great. Thank you, Ingrid.
And all right, come back here. Come back. Come on, Menti. Come on back. All right. Let me get back to sharing my screen here. Okay, and we're going to try one more time. Here we go. All right, let's see what happens here. All right. And we practiced this a few times, and here we go. I can see answers coming up. So let me get it so you guys can see it. There we go. All right. Well, my plan to have you see it isn't working. So Ingrid, it was a valiant effort, but your concern that people wouldn't be able to see it is right. So here's what we're hearing. What strategies do people have tried when someone's guardian opposes something the person wants to do? We're seeing things like team conferences and barriers committee, education and support. We tried discussing pros and cons and really educating folks, considering mediation between the person and the guardian to find some compromise, giving the person or giving the guardian opportunities to discuss their concerns, to really express their concerns, and trying hard to have an open conversation about that. We often review the person's rights, or at our agency, we review the person's rights with the guardian, refer back. In some cases, folks are serving minor children, so we have refer back to what's best for the child and provide evidence-based solutions. We really stress client rights. We advocate for the member's needs. Again, education and advocacy are showing up a lot. Empathetic listening and compromising. I've attempted to have the guardian view the other person's perspective and why they feel like, you know, why they are opposed to it, and why, you know, kind of what their concern is. We've looked at what folks' peers are doing compared to peers. We've tried reasoning, finding common ground. Great. All right, Great feedback on that. Thanks for doing that, everybody. So we ask that because, there is no one answer. I mean, if I look at the Menti responses, there are probably, I'll bet you there are 70 answers here, at least. And we know there is just no one answer to this challenge that we are faced with sometimes. So if you joined the Guardianship 1.0, or the first webinar you did, you would have seen the next 2 or 3 slides. And they are a repeat because I'm assuming not everybody who's here today joined that webinar. And this is a really important piece of understanding sort of how we got to a place, first of all, where guardianship exists, where it's in our system, and why sometimes it's really a challenge to feel like we might be as gently and empathetically, as folks said, kind of pushing back. So first of all, we have to just kind of remember and recognize that this idea that people with disabilities actually have rights, and that we have a role for advocating for people to be in support of their own decision-making is a really new concept. Relatively speaking, in the grander scheme of sort of legal processes around one person being allowed to make decisions and in some cases be responsible for another human being. So just a little bit of historical context. We can go back to ancient Rome and look at the concept of legal tutelage, which essentially said that in Roman times, not surprising, men had responsibility and ability and control over anybody that society deemed incapable of making decisions on their own. That included children. It certainly included what we would now refer to as people with disabilities. It included women. In some cases, it included older adults. But the point there is that this idea that people with disabilities are in charge of their lives is really new when you sort of place that conversation in the context of broader history. Our language around guardianship, our processes, our expectations actually have their roots in English common law. And so, we literally have the founding of the colonies, and even in that system, we have people with disabilities and older adults and children having somebody else be in charge or in control of their life. The other thing we know in the United States, very specific to US law, is that the idea, and now the law, that people with disabilities have the right to be treated humanely. There was not a law in the United States that mandated that until 1971. I venture to guess that there are folks on this webinar that are younger than that law. Right? Like that's just not, we can joke about, wow, how old was I when that came into practice? But 1971, the right to community living, the Olmstead decision wasn't until 1999. So you just get this picture, of course, that guardianship as a concept and as a practice is deeply, deeply entrenched in our system. And I skipped right over accessibility introductions, and I apologize for anybody who needs accessibility. I'm going to just digress for 1 second and tell you that I am a white woman with dark brown and slightly gray hair. I have on red glasses. Today I've got on sort of a white cream colored top. I'm sitting in my home office, and behind me is a bookshelf, and over my right shoulder is, on top of that bookshelf, a printer. Sorry about that. I apologize for skipping over that when I started. So in this space of conversations with guardians, the lens that I always look through, and I always will look through, is a person-centered practices lens. I'm one of the folks that got really lucky in this space I came into this work in the person-centered practices work specifically in the early to mid 1980s, which is when there was a very strong, really worldwide, but particularly we can say national movement around advocacy for people with disabilities to really be in charge of their lives and to manage and control and be considered as the expert of the plan and the planning that was happening for their life in the community. And most of that comes out of the fact that up until, just again, a little bit of history, up until 1981, states were not permitted to use Medicaid dollars to provide community-based services. If you were a person with disabilities and you used Medicaid and you needed support services, you were either at home without Medicaid funding or you were institutionalized. Waivers didn't exist. 1981 is when the Social Security Act was amended to include the 1915 C, I think was the first one, B, it seems like it would be A, but it was actually, I think it, yeah, anyway, either way, waivers, state waivers were first approved, which allows states to use Medicaid dollars to provide community services. And it was that process that then required people who were going to be providing services to put together some kind of a plan to provide those services. We already had individual educational plans coming out of school systems, and so most states pretty quickly adopted a very similar process that called all sorts of different things, but at the time often referred to things like individual habilitation plans, individual community plans, individual program plans, often still now referred to as individual service plans. The CMS 2014 settings rule calls them person-centered service plans. So all of that language, meaning the plan that directs the services in the community that the person is receiving. So that idea that people would be in charge of those plans really came about in the early, or started to come about in the early to mid 1980s, because waivers were coming about and people were saying, whoa, wait a minute, if this plan is about my life, I need to contribute. I need to be in charge of this. And for a long time, people were not. We did planning with folks where very literally we handed people plans and said, okay, here's your plan for the next year. Please sign it, without any engagement with the person. So when we get to this idea of person-centered planning, which is the language that advocates really gave those processes, where they said, okay, well, wait a minute. I have to be a part of this process. I have to be in charge of this process to the extent that I can be. When we get to that place where we start talking about person-centered practices, one of the things that we realized was when we are committing to somebody to engage in a person-centered process, it doesn't matter what model you're using, but when you commit to engaging in a person-centered process, there's really an implicit set of promises there. Now, you might not say, in fact, we probably would say, be cautious saying to somebody, I promise you, ... It's hard to know what's coming down the pike. And so, the idea of making a promise can be challenging. But there is an implicit set of promises here when we are committing to planning with someone in a really solid person-centered way. That first promise is that we are really going to listen as best as we can, and we're going to keep on listening, and we're going to keep on listening. All of our lives change. We know people's interests change. We know when we engage in really good person-centered practices with folks, and we give people the space to tell us what they really want, to feel comfortable sharing what they want, people start telling us more. And they really start to, as Janice said earlier, explore this idea. And we try hard then, of course, to capture this idea of a meaningful life. So it's an implicit promise to listen and to keep on listening. It's an implicit promise to act on what we hear. And that does not, let me be really clear, that doesn't translate to, therefore, I will somehow give you everything you want. None of us gets that in life, and that's not real life, and that's not what we're saying. Excuse me. But what we are saying is, you're telling me things that matter to you. I have a responsibility to try and figure out how I can help you get those things in your life. It might be service system based. It might be just community support, family, friends, neighbors, church, YMCA supports based. It may not be formal services, but I have an obligation to try and act with you to make those things happen that really, really matter to you. And the other implicit promise that is critical, and I'm going to give you an example of this, is, and this can be really hard, we have to be honest with people when what somebody wants is something we don't have a clue how to do, not any idea how to make it happen. I've been fortunate, really fortunate, to help hundreds and hundreds of people around the country transition from some kind of congregate setting. That might be a psychiatric hospital, it might be a developmental center, it might be a nursing home, it might be a large group home. Lots and lots of opportunity to spend time with people and help them move. And I can tell you, people have asked for things that we had no idea how to figure out. It either was a service that didn't exist, we weren't sure how to develop the supports in an unpaid natural supports way. It might have just been something kind of quirky that we just didn't know about. I supported somebody once who wanted to buy a school bus long before schoolie life and van life was a thing. Somebody wanted to buy a school bus. And I'd never bought a school bus in my life. It wasn't my job to buy it, but it was my job to help figure it out. And I didn't know how to buy a school bus. We have to be really honest with people. When people trust us enough to tell us what they want, and it's going to take a long time, we have to be respectful enough to say, okay, I think I can figure that out, but it's going to take us a while to do that. We can't not be truthful about that. And not that we would lie about it, but sort of that, lie of omission by just not saying, and I think it's going to take a long time. Somebody's trusted us enough to tell us, to be vulnerable with us, to tell us what they want. We have to be honest and say, okay, yeah, maybe I think, but just know that that's going to take a while. And the last implicit promise really is, we have to be patently clear with folks when the thing that they tell us they want is not something we can do. It may be illegal. It may be something our organization as a service provider doesn't do. It may be a guardian-person relationship. I supported somebody once whose biggest thing to do was to move back home with their family. And for lots and lots of reasons, they couldn't. They could not move back home with their family. But that, if you ask, that was the thing they were going to hang on to. They were always going to say, I want to go back home. And it was a really, really hard conversation all the time, because I think we all felt like we were breaking this person's heart, and our heart was breaking every time we had to say that literal thing, moving out of the home you're in and moving back into your family home, cannot happen. And that was really hard, really hard. And, I think for me, those things are important to know, because this already. I'm not going to sit here and tell you something you don't know. There's not a magic bullet to this. There's absolutely not a magic bullet to this. The folks in the mentee conversation, there were so many of you said things like continual education and conversation and empathy, and trying really hard to step into the shoes of the person and step into the shoes of the guardian. And that absolutely is, it's the only thing that will work. Will it always work? It might not, but it is certainly, it's certainly if something's going to work, that's what will. So thinking about these promises, let me tell you a little bit about Jasmine's story and kind of just give you an example here. This is a really simple example, but it captures really well those concepts. We were planning with Jasmine. She had actually moved out of a state developmental center. She was living someplace that she didn't like, and she kept saying to folks, I want to move. I don't want to live here anymore. I want to go somewhere else. And it wasn't that people didn't believe her. It wasn't that people weren't going to work on it, it just sort of became part of a rolling conversation of things that needed to be different for her. So when we were planning with her, in preparation for that, somebody on her team said, just kind of give you the heads up, she's going to tell you she wants to move, and that's a really, really big issue for her. So it has the ability to kind of derail all the other conversations. So just know that that's something she's very focused on. Okay. So we meet Jasmine, and true to the word, that's absolutely something she tells us that she wants to do. And the folks that are supporting her, very caring, very kind. She had a relationship with them, and a good one. So that I would admit helped here. But in the midst of that, in that moment, Jasmine felt safe to say, I am sick and tired of hearing we're working on it. She said, I don't know what that means. Every time you say to me, okay, we hear you, we're working on it. She's like, I don't have any idea what that means. And so when we think about this idea of a promise to listen, for Jasmine, when she said, I want to move, and she told us, I'm sick and tired of hearing it, and I don't know what it means, that spurred us to action. People had been listening to her, but there hadn't been, I don't think, an urgency from folks around what do we do about this. And so when she said, I don't know what that means, for this, again, this is a really simple example, but when you're in the heat of it, you might not think about it. We ended up really asking this question: how do we get beyond we're working on it and define that for her? What does that actually look like? What does that really mean for her? And so in doing that, one of the first things that we did, because we were physically in a planning meeting, we literally had like flip charts, So we put flip charts on the wall and we said, what's it going to take to move? Just everybody toss it out. What's it going to take to move? And we made lists of all the things. And if you've ever moved, you know what it takes to move. It's a big event. We made lists of all the things that needed to happen to move. But the other thing we did, remember that people who cared about her and were supporting her were saying, we're working on it. We took those lists and we crossed off the things that had already been done. And so all of a sudden, Jazz had this visual of when she would say, I don't know what it means. Now she knew what it meant. Now she could see on the wall, all right, there's 20 things listed here that have to happen for me to move, and 4 of them have been done. And it wasn't an evaluation of quantity at this point, or an evaluation of have you done enough. This was define for her, what does it mean when we say we're working on it? So we have listening to and really trying to dig into what does it mean. I don't know what it means when you say you're working on it. We have this promise to act on what we hear. Let me show you. Let's visually show you that we are working on this. But the third part for her was the timing. We were planning with her. My recollection is it was like August. And we said to her, we know it can't happen tomorrow. Look at the list. There's a whole lot of things that have to happen in order to move. We know it's going to take a while. What's for you, Jasmine? What's reasonable? What would work? And she said, Halloween. So we were in August. She said, if I move in the next 6 weeks, that sort of, I'll be okay with that. We asked the folks supporting her, and they said, we don't think we can do it until Christmas. Now, I know if you walk into Target the day after Halloween, they have Christmas decorations up. And so I know it feels like there's not very much time between Halloween and Christmas. But the fact is there is. So she was saying, I can sort of work with this for another 6 weeks. And then she had people saying, we're going to add 6 weeks to that. And so all of a sudden, people that were supporting her were saying, it's going to take us 12 weeks or something to help you move. And that idea of time and how long is it going to take, really, that was really difficult for her. But again, I don't know that anybody had, I do know that nobody had yet had this conversation with her. And so when we listened, when we acted on what we were hearing, and we could be honest and say, we don't think we can make it happen by Halloween, but let's figure out if we can make it happen before Christmas. And so that implicit set of promises when you're looking through a person-centered lens is one of the ways that we can really support people to get the things that they want and that matter to them. And these are conversations we ought to be having with guardians as well. So I've applied this kind of framework to somebody who uses services, but imagine applying this framework to a guardian. Really, really listening. What is that guardian saying? And I'm going to show you an example here in a few minutes as well. What is it that the guardian is saying to us that we can act on pretty quickly? And how can we be really honest and say, I don't know that I can do that thing. I don't know that we can make that thing happen. So again, that implicit set of promises. The other thing that happens when you have the conversation, when you are having a conversation with guardians, and you probably, if you joined the last time, you would have heard me ask a similar question. I'm going to go back a slide. If I start in that promise to listen place, one of the questions we ought to be listening for, one of the answers we ought to be listening for is, does guardianship really do what the guardian thinks or hopes it will do? So I'm going to guess that many of you have had the experience of a guardian saying, or a guardian opposing something the person wants to do because it's not quote unquote safe. And they may be absolutely right that what this person wants to do may not be safe. Guardianship in and of itself isn't going to help somebody stay safe necessarily. Life is risky. It just is. And the simplest of things can be risky. Many of us have probably had the experience of slipping down the steps or tripping on a curb or burning our hand on the stove or whatever. Not necessarily because we might have been doing something unsafe, but we might not have been. Having a guardian wouldn't have necessarily resolved that. So, and that's not meant to be an antagonistic question or adversarial question at all. It's really a question of, it's a way for us to, the cliche is you sort of peel the onion, kind of get underneath, really get to the why from the guardian of what are they expecting as their role, in their role as guardian? What are they expecting from us? What are they expecting they're able to do? And going back to our promises and saying, maybe we can't do that, whatever that thing might be that the guardian is requesting. So really understanding, where the guardian is coming from. I'm going to tell you a quick story about Alexander. Alexander is somebody I used to provide services with a long time ago. He's a bit of a combination of people, but you'll get the idea here. And I'm going to show you a tool that can be really helpful when you're trying to kind of keep track of what have we tried so far, what have we tried so far, whether it's about a conversation with the guardian or whether it's about an issue that the person is presenting with that the guardian's really worried about. And this is a good tool to use when the person wants one thing and the guardian is really struggling with that. So Alexander is a gentleman who has multiple mental health diagnoses. He's had several hospitalizations in a state psychiatric facility. He lives currently in what in North Carolina we would call kind of a rest home, adult care home kind of setup. He lives with a lot of people, and it's not something he loves. He would really, really like to move. He's not somebody who wants to live alone. He would like to live with a couple of roommates. He's not had the experience before of living on his own. When I knew him, he was probably in his 30s. So he's not a kid either. He has a part-time job. He has a part-time job that he likes. He goes to work pretty consistently, but some of it really does depend on how he's feeling, sort of just mental health stability. This is a guy who, from a mental health standpoint, life is just, it's a little bumpy. Generally, he's pretty stable, but it's a little bumpy. We'll show you a quick piece of his crisis plan. There are some very, very specific, clear indicators that little bumpiness might be becoming big bumps. So if you really think about his crisis plan as an advocacy tool, it's a really, really good way to be proactive and advocate with him to do some things that he can do that might actually mitigate the instability. But so he's got, he's, again, day to day, it's a little unstable, nothing significant. It is just kind of part of who he is. There are days he doesn't want to go to work. He happens to work someplace as a contractor, and he can show up for work when he wants, and they're not terribly worried if he doesn't show up. He also has a friend that has a working farm, and he really likes spending time at the farm. Alexander, who wants to be called Alexander and not Alex, likes to do really physical work. So he likes going to the farm and hauling bales of hay and mucking out stables and that kind of stuff. It's something that he feels like he's good at, and it also is kind of physically tiring. And sleep is by far the most important thing for him. If he sleeps well, he will absolutely most of the time stay really, really solidly stable. If his sleep is really out of whack, it's the thing that can create a significant crisis for him. The other thing to know about Alexander is his brother is his guardian, pretty involved with him in a very good way. But the other experience that Alexander and his brother had was that when they were young, when they were before age 10, their mother was killed in a drug-related home invasion. So there are some pretty significant trauma. Alexander lives with some pretty significant trauma, and there are some dates that can be really difficult for him, particularly the date of his mom's killing. That's a really tough day for him. So again, some of those kind of proactive crisis strategies, things that we know ahead of time that can be helpful. So this is one tool that can be really helpful when you're trying to navigate this space with a guardian. This comes from Charting the Life course. This is the life trajectory family perspective, and then there's another version of this that is the kind of the exploration perspective. The end of the slideshow, when you get a copy of the slides, the resource for downloading the Charting the Life course tools, that link is there, and these are all free tools. I think this version, the exploration trajectory, is a little clearer and cleaner to use. This particular family perspective, though, can be really helpful when there are lots of people engaged in planning with somebody. But for Alexander's example, I've used the exploration tool. I said I have been fortunate to be involved in person-centered practices and planning since the mid-'80s. And I will tell you that this is absolutely by far probably one of my most favorite, and I think easiest and dramatically powerful tools to use. There's lots of models of person-centered planning out there. All of them have some kind of question around vision or North Star or what's your biggest dream. I mean, that's really the intent of good person-centered practices. This just captures such clarity around what do you want? What don't you want? What's your vision for what you want? What's your vision for what you don't want? And Nancy's going to talk a little bit about this later. We had a great conversation about this the other day. I have a colleague who's a parent, and she does a lot of parent training. She has a young adult with disabilities, Her son is a young adult with disabilities. And she tells families all the time, if you and your family member don't have a vision for your life, somebody else will. And what somebody else's vision is for your family member's life may not at all be what you want it to be. She's really clear about have these conversations, engage with people who know and care and love your family member, and get really clear on what they want. What you'll see when I show you Alexander's is that we're going to compare Alexander's and his brothers in just a moment. The trajectory is it really is just that. It's an arrow, and it basically says in the top left corner, tell us things that you want when you think about your life and craft this vision for us, and think about things that you don't want. And let's be really clear and write those down. Let's just make sure that we all see this. Not because we're necessarily aligned yet, but let's get a clear picture of it. You can do this. You can print these from the Life Course Nexus website as a large tabletop, not as big as a table, but bigger than 11 by 17, whichever the next size up is, version of this. If folks want to literally sit and practice it and play with it, they make it really easy to get to these tools. And again, it works really well. So if we asked Alexander about his vision, he would tell you that I want a life like other people. I don't want to live with 12 other people. I want my own bedroom. I want my home to be quiet. I'd like to be able just to have friends come over and watch movies or play games or have dinner. I'd like to try and have my rights restored. I would like to work some more hours if I can, and I would like to spend more time working at the farm. I want to be healthy. Alexander is somebody who tried really hard to kind of live in a space of good mental health, good physical health. Just that he knew that those combinations worked really well for him. He didn't love taking medicine, and he had several diagnoses for which medication was prescribed. That was sort of always a, I'll do it, maybe, sometimes don't want to. That wasn't always consistent. And someday he said, I'd like to have a romantic partner. What he doesn't want is, I don't want to go back to the hospital. I would like to be my own guardian. I love that my brother helps me, but someday I'd really like to have my rights restored. I don't want my brother telling me where I can live. I also don't want to worry him. And that was the tension for them, was creating this kind of worry. I don't want to keep living with a lot of people. I want to be able to come and go as I please. I feel like I'm treated like a child. So you get a vision of kind of how he's living right now. And then some real clarity around, I want people to listen to me, respect that I am capable of taking care of my mental health, to know that if I'm unwell, that if I get sick, that there are people I trust who will help me. I would love to share an apartment. I don't want to live alone, but no more than 2 other roommates would be my request. Again, would like to spend more time on the farm and keep his job at the warehouse. He wants his brother to be proud of him. That's, this is an important relationship for him. He wants to have pictures of his mom in his home. That really mattered to him. He had a great ACT team, and he trusted folks. He really trusted that they were, well, not that they would be, they were there for him. He just had a really strong team. And again, really wants his rights restored. So kind of repeating information now, but you get a picture of, as you are talking to him, you can just begin to kind of categorize things. Roberto, his brother, says, I want to worry less about my brother. Since our mom was killed, I just worried that something will happen to him. And it wasn't so much that he was worried that Alexander would suffer the same fate, if you will, that his mom had experienced, which was just horrific. But it was just overall that he had responsibility for keeping him safe. I want him to live someplace where he's safe and he can get the care he needs, and I want him to feel like he is settled. But if you asked him what he didn't want, his brother, he would say, and this was, I think, the driving tension for them. I don't want him to move and have it not work out. What if he had to go back to a hospital? What if he couldn't manage in an apartment? He said, I know that he doesn't love the rest home, But for the moment it works. Like I feel like there's always somebody there who can sort of have eyes on him. He also absolutely knew, I feel like we just keep having this conversation and I feel like I'm the obstacle. And I don't really know what to do about that. I don't know how to feel better about what I feel like is my responsibility and supporting him to move. He was very, very worried that something would happen and Alexander would end up going back to a hospital, which he knew he didn't want, and then being really stuck to kind of get back to a community, get back to community sports. He could also tell you that what he wants is he wants his brother to be happy. He wants to know that he's safe. He wants to help him figure out how he can have more control over his kind of day-to-day life. He wants to worry less. And even if I don't see him frequently, he said, I worry about him all the time. And I think he is a good example of somebody who, in this case, cares a lot, cares tremendously about his brother. He recognizes that his worry, his angst is probably one of the obstacles to Alexander moving. And at the same time, he's realistic about the what ifs, like, let's think this through a bit. And Alexander's crisis plan is one of the ways to think through those what ifs. You know, again, there are some really clear, very clear triggers for him. Actually, not triggers. There's some very clear indicators of when he is becoming unstable. And I'll show that to you in a minute. But so if we compare these visions, and this is, if I go back for just a moment, you know, when you are doing, if you're doing this kind of, using this kind of a tool, it can be easy when you're in the middle of that tension. It can be easy to feel like we're just not aligned. It's just not working. And so, you know, being able to tease apart a bit and be crystal clear about what actually works and what actually doesn't work. Where are we aligned and where are we not aligned? We want to put energy into both of those. It's easy sometimes if things are aligned to sort of say, okay, they don't need a lot of our attention because they're doing fine. And I would say to you, really do have to give some attention to things that are going well because you want them to keep going well. But, you know, if we look at their visions, absolutely, Alexander wants to be happy and he's got some clear definition of how that can happen. And Roberto wants him to be happy. Alexander has a team of people that he trusts right now if he is unstable or becomes unstable or starts to become unwell. That matters to Roberto. He needs to know that those people are there. And Roberto is certainly somebody who can, in systems language, he's a natural support. He can certainly be of support and he can be helpful. He's also married with 3 young children and has a job. So he's very clear about, you know, I'm not in a position where I can just like come over every single day and do something. Alexander tends to go to Roberto's house on holidays, spend time with the family. Sometimes they'll take a vacation together. Alexander will also tell you that 3 little children is a little overwhelming for him. So there are times where he's like, you know, I'm going to go have dinner with them and then I'm done. So it's not that Roberto's not part of this caring group of people, but he can't be the primary support. And, you know, Alexander would, I think if you said to him, if you identified places that he could live that he thought were really unsafe, if you to demonstrate, you know, living in a way that was unsafe, that would not fly for him. He recognizes that there are things about the space that he's in right now that contribute to Roberto certainly feeling like he's safe and him feeling like, okay, there's some things that work here. Still not what I want, but it's not like it's all bad. What's not aligned is what needs to happen for Alexander to be happy. You know, that's the thing where they're not aligned right now. For Alexander, it's about moving. And Roberto's struggling with that. And that's very tied to where Alexander lives. So you get to picture them when you compare those visions. And then you have a way to say, let's dig into this a bit. What would need to happen for Alexander to be happy and Roberto for you to be okay with whatever that looks like? Let's really think that through. And I would go back to, I'm not gonna flip the slides backwards, but I would go back to that third promise about honesty and time. You know, people who don't use supports and services in our system have the ability, maybe, probably not always true, but maybe might have the ability to pack up and move out of one home into someplace else, possibly a little bit easier than somebody who has to figure out the coordination of supports and services along with the absolute chaos that is moving. And anybody who's moved knows that. So when we think about time, and I think go back to Jasmine's story where, you know, her provider said, we think it's going to take another 12 weeks to really make this happen. And Jasmine was like, I need it to happen sooner than that. So that honesty piece, where is Alexander going to live? How long is it going to take to really get that in place? And does that contribute to happy or unhappy? What does that look like? So the other piece of this is this getting to action. You know, we can compare visions, we can do trajectories, we can compare visions, but in any process, I would say to you, in any solidly person-centered planning process, if there isn't an expectation of action, then we are really acting unethically and irresponsibly and cruelly to the person. Person-centered practices and person-centered planning sets a different tone. It was designed to set a different tone than sort of traditional systems directed planning. North Carolina has an entirely new person-centered planning process. It's been evolving for many, 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 many years. The idea really is to present a different tone and expectation when we encourage and support people to be, as Nancy, who's going to join us later, says, the CEO of your own life. If part of that isn't, from our perspective, if part of our obligation is not to act on those things that we hear, right, those implicit promises, act on things that we hear, be honest about time, really continue to listen. If we don't have a commitment to action, we're really being unfair to somebody. Faye Wethrow, who does a lot of work in the model called PATH and another model called Star Raft, Faye Wethrow often says, when people share their dreams and visions and hopes with us, we are walking on sacred ground with them. And I think that's it's one of those ones that, you know, I heard her say it once and I kind of tucked it in my brain because it really struck me as important. When we give somebody the space to be vulnerable, to say, okay, here's my vision for my life, and it might not look anything at all like what you all think my life should look like. That's a lot of vulnerability. So we have to be prepared to act. And so when we think about Roberto and Alexander, then there's really, that's the question that comes up. What does it take? What would it take for Roberto to worry less and feel like Alexander was safe? And again, safe is a bit squishy around the edges because safe is very individualized. What one person feels is safe, another person absolutely does not feel safe. I always think the simplest example of that is skydiving. Like, you know, there's just not enough money in the world for me to jump out of an airplane. It just isn't. I don't even know if it's about safety, but I'm not jumping out of an airplane with a parachute. And there are a whole lot of people that will do that. There's a whole lot of people that will do that. Are there things that Alexander can do to help reassure his brother? You know, I am responsible. Alexander keeps saying, I want my rights restored. That certainly, he is also, the ability to have your rights restored is absolutely attached to what responsibilities will you take in your life? So what can Alexander do also to help reassure his brother? How can we define or redefine happy? And how can we begin to align those visions? Because I'm not sure that Roberto even has really defined happy for Alexander. Alexander has a vision of that. I'm not sure Roberto does yet. And what does it look like if we take Roberto's definition and apply it to Alexander's life? Does it work? I'm not sure that it does. at the moment, in that moment in time in planning. Could it? Absolutely. Roberto has a role, has a legal role right now in Alexander's life. Whether he is, one of Alexander's wishes is to have his rights restored. I have no idea where Roberto is on that idea. But if he were ever to get there, you have to imagine that he'd have to feel confident that there was a group of people absolutely ready to act, support, care, be engaged with his brother. Should he need more support than kind of ordinary day-to-day. Let me really quickly show you. So one other tool. Sorry, I'm going to show you one other tool here. This is a quality management tool that actually comes out of. I think this originally came from IBM, if I'm not mistaken. We've adapted it in person-centered practices. This is a look back. This is a way to sort of assess where are we in our process. I have found this tool really, really helpful when there's an issue that people are just kind of ruminating around and they want to keep track of, what have we tried so far? Did it work? Did it not work? Were we happy with how that turned out? Are we worried about it? And from a system standpoint, this can be a really helpful tool when we think about turnover. I have a friend who's a parent who talks about, her son is in his 40s. He has used mental health services for most of his life. And one of the things that she talks about all the time is just the challenge in the system of having she lives a place where they have case managers, where new case managers come in. And even if they've read the record, she said a lot of case managers come in and I feel like we're starting from kind of ground zero. And I want to say, wait, let me tell you all the things we've done over the years that we have tried and figured out and what we learned from that and what about it worked really well and we were really pleased with it and what about it didn't work and we have a lot of concerns. And she's kind of kept this running log for years of things that work or don't work for her son. We casually refer to it as the 4+1 tool. It comes out of person-centered thinking and the learning community for person-centered practices. It's absolutely an assessment and a look back of what we've tried around a very particular issue. You can't do a 4+1 for life. You have to do a 4+1 around a thing in life. It's a way to record our learning. And it's a way to plan for short-term action. It is not designed for strategic planning. So this is not a 1-year, 3-year, 5-year tool. It's a really great way to keep track of things that are happening between one meeting and another meeting, like quarterly meetings, for example. And it literally just asks you, what's the issue? So I think in this case, what did I try? Yeah. So the example I gave you was Alexander sleeping. We know Alexander generally sleeps, I'm going to say relatively well. We know that when he's not sleeping well, it can be a first indicator of a potential, it may not be a crisis, it may just be some instability, but if he doesn't sleep well for 3 or 4 days, that's a red flag. And we ought to be considering, he might at that point want to call his doc, he might want to call his ACT team, he might want to try a couple other things. Again, physical labor is real, he loves that kind of stuff, and it tends to wear him out, and he will sleep really well. But as an example, some things that you could imagine trying, and just being clear about what we learned from it. So you can imagine somebody's probably tried melatonin. Didn't seem to have a whole lot of effect, but as somebody who doesn't like to take a lot of prescription medication, he was thrilled. He loved trying that. He also knows that sometimes he just needs a very short course of a low-key sleeping medication after a few days just to help him kind of get back on track. One of some of the other things that have been tried, tracking how many nights he doesn't sleep well. Sometimes it grows. People say, oh, he hasn't slept well for a few days. Well, what's a few days? Oh, I don't know. I think it's 3 or 4. And the next person says, well, I don't know. I thought it was like 6 or 7. let's actually track it because it matters. It really matters for his health. And what we learned was that it's often fewer than we think. It feels bigger because we're worried and he's worried, but it's actually fewer than we think. And usually after a couple of restless nights, he will sleep well. What we don't know is not sure if there's really anything that triggers that. We know he doesn't sleep well. His birthday is a difficult date for him. We know he doesn't sleep well when the date of his mom's killing is approaching, and sort of in that time frame that always, right, not, you can imagine, throws him off a bit. But otherwise, we're not sure. Does he have a little bit of insomnia? Does he just, is his brain just kind of spinning a little bit, like happens to all of us sometimes? And what have we tried? Sometimes he will text somebody or ping somebody during the night if he's awake. And sometimes talking is just really helpful. We know that he really appreciates that somebody will answer the phone or take the phone call or answer his text, because he literally thanks us. And he seems worried about that. He also is a little worried about, did I wake you up? Am I interrupting your night? But we know that having someone available sometimes to talk to can be very reassuring. That doesn't mean that we're still interested in doing everything we can to help him, kind of sleep through the night. And when you do the 4+1, you are really looking at action. And so when we look at Alexander's, after we sort of captured this and we say, okay, what are we doing next over the next few weeks? We're going to continue tracking his sleep, self-reports from him, but also logging any calls that we get. We're going to look for patterns, see if we can figure this out a bit. Are there some connections between nights that he doesn't sleep well and any specific activity or something that's going on during the day, and review that again in a couple of weeks. Or again, this might be a quarterly thing. She might be reviewing this in a few months. But this particular tool, just pretty simple, 4 questions plus 1. We used this with somebody who was an older woman who was malnourished. And her care team was suggesting she needed to possibly go to the hospital and have an NG tube. And she really, really, really didn't want an NG tube. And we started kind of thinking through all the things we could do and had tried to do, and what else could we do around helping her not get more malnourished and in fact become healthier. And one of the things that she did was she took this completed document back to her doctor and said, we got a plan. Let me show you everything we've tried and what we're doing next. And, she's her own guardian. I shouldn't say it that way. She does not have a guardian. So sorry, lost my train of thought there. She does not have a guardian. So she could also say, I'm not going to the hospital. I know you want me to, but I'm not going. But it was still something she was worried about. And I'm very, very convinced that her walking into that doctor's office and saying to them clearly, let me show you what we're doing, we have a plan, was really a turning point. It was empowering for her. It was a great advocacy tool. And I think it really helped the people on her care team also feel more confident that, in fact, people who loved her and cared about her were paying attention to this issue, and in a way that really mattered. And they had some action, ready for it, ready to deal with it. So 2 tools there, the trajectory and the 4+1. I'm going to show you really quickly one piece of Alexander's plan, and then I'm going to turn to my conversation with Nancy, because I think that's actually the best thing going today. So Alexander's plan, really quickly, this is just from the North Carolina Crisis Plan. Brief description. It's really important. He prefers to be called Alexander and not Alex or Xander. When he's well, this is a guy who, I think even when he's not unwell, in my experience, but he is goofy and he's funny and he really likes to be with people. Isn't necessarily extroversion, but he's not somebody who loves being alone, is really, I think, the way to describe that. It could be that he wants to do something he enjoys, again, loves the farm animals, loves helping on the farm. The friend that owns the farm is part of a support group, actually, a grief support group for people who have had a loved one who's been murdered. And that's how he met this person. And they just really kind of clicked, and they're just friends. And that guy is a really big support for him. He happens to live in a community which is not far from a beach, so sometimes just heading to the beach is something he likes to do. But you know, he could be hanging out with anybody. It isn't necessarily about doing stuff. He just really likes to be with other people. He's energetic, but he's not like chaotic and all over the map. His crisis plan, a couple of key things in his crisis plan. So we told you, you know, he has several mental health diagnoses. Our experience tells us he probably has a mild intellectual disability, maybe a significant learning disability. He was never tested when he was younger, doesn't receive those services, but when you watch him learn, you sort of get a handle on new learning can be a little tough. Adaptive learning can be tough for him. When he's not well or he's starting to become unwell, there are a couple of things that happen. People that know him well say, absolutely, you will always see this. And the first of those is that not sleeping. So that's, if we think about this as an advocacy tool or sort of a proactive strategy, then, you know, what we learn is that we can't just blow off the sleeping. We can't say, oh, well, it was just a rough night. One night is one thing, 2 nights maybe. We start hitting 2 or 3 nights of 3 or 4 nights, sorry, of not sleeping, we have to pay attention. And then if some other things happen over a period of a week or 2, he has to be talking to his ACT team. He's got to be seen. We may be talking about a short course of some sleeping meds. We may be talking about some medication adjustment. So might not sleep well. Oops, sorry. The other thing that, and this is when you're really like heading to the place of, okay, we've got to get him, he has to be seen clinically. This is really worrisome. He starts making biblical references. He starts talking about people being sinners. And the other interesting thing is he complains about being too warm. He will tell you that the temperature in his house is too warm or in his room is too warm. And he has a window AC unit in his room, which is fine, except that if he's too warm, he will crank it to the coldest temperature and he'll leave it running forever, you know, and then it freezes up and it doesn't work. And then he gets warmer or feels like he's getting warmer. And so that is a potential cycle. He also has had one experience of when he was really, really unwell and he wasn't being treated well. He had an experience of stripping all of his clothes off because he was too warm and it was the only thing he could think to do, and trying to walk away from where he was and walking down a road and actually getting arrested for indecent exposure. That's terrifying for him. He's very, very, and there's, if you saw his full crisis plan, there'd be more information in there, but that's a really big issue for him around doing everything all of us can to not have that happen again. He does not want to ever get arrested again. So you get some pieces of that in his plan as well. You could absolutely do a 4+1 around, you know, what happens when he's too warm and making sure that he's, again, safe in a way that if he needs to strip all his clothes off, he can, but he's not going to get arrested for indecent exposure. You could do this around medication issues. Again, sometimes, most of the time he's okay taking meds, but he doesn't like taking a lot of them. So sometimes he's not. You could do a 4+1 around that. Any issue that you want to keep track of, what are we learning about this? That's a really good tool to use. All right, I am going to stop here. I'm going to stop sharing. And I'm going to introduce you, or hand the mic over to my colleague Nancy Johns to introduce herself. And this is a panel of 2, if you will, or a panel of 1. What we're gonna do is, Nancy and I talked a lot about this webinar, and we kind of sussed out 4 questions specifically that we had a lot of conversation about. So I'm gonna ask Nancy to introduce herself, and then I'm gonna pose the question and just open it up for Nancy to tell us her learning and her experience, because I think her wisdom is well beyond her years. And I will tell you, and I mean it, I never, ever, this is grammatically incorrect, I never, ever don't learn something. I always learn something when I talk with Nancy. Nancy?
Thank you, Leigh Ann, and thank you for inviting me and allowing me to be here with all of you today. I'm 63 years old today. I mean, not today, but at this point. I was an officer, combat medic in the Army. Then when I got discharged, I became a life flight paramedic for a trauma center and pilot. I did that for about 15 years. When I got injured on the job, suffered a traumatic brain injury, and that is kind of what led me into the system, the mental health system. That was around a little over 30 years ago, and I've been, have had my ups and downs in the system. So today, I am a peer support specialist. I concentrate on trauma and suicide, and I lead support groups for those who have attempted and survived, or those who deal with chronic suicidal ideations in the UK and the US. And I'm an advocate for being a voice for the voiceless.
Thanks, Nancy. I'm so happy you're here. Thanks for joining us. So when you and I first started talking about this webinar, you suggested that we really start this conversation about, how do you engage guardians when the person wants something in the guardian, as opposed to, you suggested we start this conversation with the idea of agency and autonomy for people who are part of our service system. Can you just talk a little bit more about that and sort of how that idea of agency and autonomy really shapes your belief and the work that you do?
Well, basically, everyone knows that our basic human needs for survival are food, water, shelter, safe, the safety, the health, all that. But we also have needs that are considered not essential, but are for us to thrive. And that's agency and autonomy, being able to have purpose, and hope and meaning. That's what we need to survive. We're not robots, we're humans, and we don't want to just survive. We want to be able to flourish. And agency and autonomy is a big part of that. Having a seat at the table.
We know sometimes that what a person wants, and I apologize, I'm kind of reading my questions because I want to make sure since Nancy and I went through these questions, I want to make sure I give her the right question and not something that I've just made up all of a sudden. We know sometimes that what the person wants and what the person's guardian wants can be different. And we know sometimes the guardians can restrict what a person wants to do. And in doing that, of course, they limit the person's autonomy. In your experience, what are some things that we can do, that people who are working with somebody who has a guardian that's kind of in a different place than the person, what are some things we can do to help bridge this gap between the person and the guardian?
Well, I think the number one thing is to know how to communicate. Communication is essential. We don't want to be adversary. We don't want to be blaming. We want to be able to listen and hear each other and be patient and open-minded, and hear both sides and validate each other. And I understand why you feel that way. Validation and communication is key, because it builds trust. It builds an alliance between the two of you. Because if there's trust is not there, then we don't, that there's no communication. We're not listening to each other. And also, a lot of us, who are dealing with mental health issues, we've been told by society that we don't matter, that we're not important, that that it doesn't matter what we say and all that stuff, and we've never been given the opportunity to be curious, to know what we need and what we want, because it's always been done for us. And that being curious and going out and finding, experiencing things on our own, for ourselves. That's how we become resilient and learn and grow.
When we talked about this, one of the things that you had mentioned was this idea that sometimes, what we hear from a guardian when they feel like things are sort of working, we'll hear from a guardian that notion of, if it ain't broke, don't fix it. And you said to me, but it might be broken to the person. Can you just talk a little bit about that?
We want to be able to live our true selves. And somebody might have what works for them, what they think is their definition of safety, of happiness, point, what their definition of it may not be my definition. We're individual, we're complex, we have different experiences in life, and different wants and needs. And so we have to really listen to the other person to find out where they're coming from. Because I don't want to live your life. I want to live my life, you know. But that's not to say that I know everything. I still need your help because, none of us know everything. And, so we still need help and guidance, but we have, like, again, I'll use that quote, a seat at the table. We still want to have, input and be validated for our input and know, be told that, we do matter.
Yeah. Yeah. Thank you for that. The other part of that conversation when we were talking about this tension sometimes between guardians and the person is I loved you said to me, you've got to look at the person's motivation. And we talked about that both from the perspective of understand the individual who uses services and what their motivation is for whatever it is they want, but also understanding the guardian's motivation. If you could just talk a little bit more about this, I have this quote from you I love, which was, the bottom line is that likely the guardian doesn't want the person to suffer, but
And I think you can see in your example with Alexander, Roberto wanted him to be happy, and he felt that he was safe in where he lived, but that's not what Alexander wanted. There was too many people for him. And sometimes, that just that fact could affect his mental health and his growing and his resiliency, and then he can become resentful because nobody's paying attention to what he wants, and that can have a big effect. So again, what your definition of safety and my definition may be two things, but it doesn't have to be all or nothing.
yeah.
We have to be able to try and experience. All human beings, we try, we fall, we get back up, we brush ourselves off, we learn. So maybe next time it's not a fall, it's just a stumble.
Right.
And then we keep on going and we keep on going. But we have to be given that, that is be able to do that on our own. So we know that we have purpose, that we're not just something that just, is like a robot. Yeah.
Awesome. Yeah, I think when we talked about this the other day, that all or nothing, relative to that all or nothing, you also said to me, it's so rarely that it's just black or white.
Right.
You've got to, a minute ago you said you've got to have patience, and that constant back and forth collaboration.
And then you work on a system. You do little steps. You don't have to go throw the person to the wolves. You do gradual steps, and then we see where we're at and what we may need to move forward, what worked, what didn't work, and then we keep on going.
Yeah. And so my last question, you framed this so well when we were talking. So when Nancy and I were talking about this webinar, I was showing her the trajectory as one of the tools, and that question about, what's your vision? And one of the things that you said was, creating a vision is helpful, but it needs to be relevant and real. It needs to be grounded in relevance and reality. And y'all, I got to tell you, that's my new mantra. That is absolutely my new mantra: relevance and reality. It really was like the best piece of guidance I think I've ever heard. So I'm just gonna, if you could sort of talk a little bit more about that notion of, relevance and reality, and maybe it's not winning the lottery, but sort of that whole idea of a vision and relevance and reality.
Well, I can only go from my experience as far as, like, my providers would say, this is what you have to do, this is what you have to do, and this is what you have to do. And for some people, I mean, it was good advice for some people, but it wasn't relevant to me. It didn't fit in with me. It didn't fit in with my life, and and I had to, learn my own path. So of course, sometimes my wants may be grandiose, and not based on reality. You think that, if I get through this, then everything is going to be okay. Everything's going to be great. When we all know that things always seem to happen, so that's why we need guidance sometimes, not particularly have somebody in charge of us, but kind of just somebody to say, hey, give us a nudge, say, maybe you might want to relook at that, or maybe, not tell us that we're wrong for thinking this, but maybe let's relook at this, and maybe we can again look at those pros and cons and have it written out.
Yep. Yeah. That you mentioned a book when we talked the other day about you mentioned a book called The Magic in the Mess, and the idea that I think we were talking about, what I might perceive as messy or chaotic or sort of turbulent might not be at all for the person, or it also might be a way to, the magic is in that mess. That's sometimes where you learn.
That book was written by a person named Molly Booker, who has a mental health diagnosis. And all through her life, she thought that, she had a chaotic childhood, and she thought as long as she got A's in school and did everything right, that she could just go on smoothly, won't make anybody mad, then become, she went to college, good grades in school. That's the way what I have to do, so nobody's mad at me. I can fit in, not belong, fit in. And there's a difference between those two words. And then, she was raised in a family that said, you get married, you have kids, you have a house, and she was married twice and gotten divorced. It just didn't work out. She was a perfectionist, and everything had to be done the right way, or and it just was just too stressful. She wasn't thriving. And then she finally took a look at herself to find out what her truth is. And she found out she didn't like men. And so now she's in another relationship, different relationship, and she's thriving. And she found out that everything doesn't have to be perfect. There's magic in that mess, just you can enjoy the mess. Everything doesn't have to be, you know, it fit in all the same, different boxes. You can enjoy the mess.
Enjoy the mess. That's awesome. Well, I could sit here and keep listening and talking, but we are almost at the end here. So I'm gonna say thank you, Nancy. Great comments coming in chat. Again, I so always appreciate your insights and your perspective, and really, really enjoy spending time with you. And thank you for your willingness to join us. I hope it for everybody was as insightful as it always is for me to listen to Nancy share her story and her experience.
Thank you so
I'm gonna-
much.
Oh, you're very welcome. You're welcome. We thank you so much. I'm going to share my screen again so that Ingrid or Janice, am I turning it back over to you to talk about the last pieces here?
Yeah, I'm going to do some housekeeping on the back end. A reminder to everyone, if you did have any questions, please go ahead and put them into the chat, and we'll try to take them quickly. Just a reminder, if you are intrigued, and we hope you are, around tools like the trajectory and the 4+1, and how do you use those person-centered tools to really proactively plan together with people and their guardians, those tools and many more are available to you on the BHS Person-Centered Planning Resource Toolkit. It's available to those of you who have taken the required introductory PCP training. So if you've not yet taken that training, there is a link on the slide, and you'll get that as a handout. We'd encourage you to do that. I mostly just want to say a big thank you to both Leigh Ann and Nancy. I could have listened to that again for another hour. And just a summary point that what I think stood out for me really beautifully is thinking about this through the universality of the human experience, right? Like how we all learn and grow is that we have to try new things, plan as thoughtfully as we can, using the best tools that we can, plan thoughtfully for them, have that experience. And if we're using those tools, maybe we might stumble, but hopefully we don't fall. And I just really appreciate both of you offering us some tools around this. And please do not forget, if you can go to the evaluation slide, and as you do that, lots of resources. There's a QR code on the screen. Ingrid is also going to drop the chat link into the chat box. You are required for your MVCC credit to do this very brief post-training survey. You're only going to have 2 weeks to do it. You'll also get this link again by follow-up email, but it's short and sweet, so I encourage you to grab the code now. And then the last thing that I will say, just by way of housekeeping, is that I noticed we had a number of people who are showing up in our chat as only by phone numbers. If you are logging in as a phone number, we need you into the chat to put that phone number, your name, and your email, because we need to be able to link the phone numbers to the Zoom registration email. And we want to be able to do that to be able to look into your MVCC certificates again. So if you're logging in through a phone number, your phone number and your name and your email, please, so that we can help you with that, okay? And then I thought I saw a question that Ingrid has also put in the link to the required introductory PCP training into the chat box. So again, encourage you to check that out if you have not already done so. I think at this point, gotten over 10,000 of your colleagues across North Carolina to do that, but we're always looking to increase the reach. And then
Janice, this is Leigh Ann. There was a question about the 12-hour person-centered thinking training. I'm going to stick my email in the chat.
Yep.
There are several folks in North Carolina doing that training, and there's at least one pair of folks that are doing it frequently virtually, really, really, really well. So I can connect folks.
And that is a question that often comes up. Additional person-centered planning trainings are always encouraged. There's some really beautiful stuff out there. Leigh Ann's offering to connect you to that. But just keep in mind that if you work in a program where your service definition requires PCP, they do want you to take the 3-hour version that we completed over the last couple of years, partly because it also introduces some of the official North Carolina documents that support this initiative, the guidance document, a suggested template, and there's some really helpful stuff in it for you. So please do check that out, as well as take advantage of any and all other opportunities that you can get in terms of additional PCP training. Cassandra, if you are registered under that email, that is the email address that your certificate will go to. I'm just trying to. Okay, so those may be folks who had been signed in by phone number. So thank you for doing that. There are different certificates. There are certificates for today's 90-minute webinar. It is approved. If you do the survey and if you participated for the full time, there's a separate kind of certificate that you would get if you do the 3-hour version of the PCP training that's on the BHS website. Okay. All right. Well, I think that we managed to get through it, and it's 2:30, and we want to be respectful of your time. Again, a big thank you to Leigh Ann and Nancy for leading us today, and hopefully we look forward to seeing many of you on future webinars. Thanks so much, everyone.
Thanks, everybody. Have a good afternoon.